for our viewers, CAD CAM. What is that?
Yeah, so it stands CAD, Computer Aided Design. That means that we need to have a computer, a software, where we will be designing most likely teeth. They could be from a single crown, something very easy to do,
Simple, yeah.
to full arch, fixed bridge type of restoration over multiple implants. And then CAM starts for computer aided manufacturing. So the manufacturing part is the second stage of CAD-CAM, where we have different materials, mainly in discs or blocks. And we have these milling machines, which are like small CNC machines, and they will basically create what we've designed previously.
Oh my goodness. So now you're taking technology, and you said you and your family invested in that 10, 12 years ago?
Yeah, January 2000.
Oh my gosh.
And we were probably at that time very early adapters of that technology.
Sure.
And we had less resources to really learn and become experts. So the learning curve at that time was steeper,
Very
I would say.
steep, yeah.
But you just at least me, I got into it, and you started, thinking how could this work, troubleshooting and repeating, and until you made your techniques. Then you went to the different experts or users meetings, and then we had the same concept that you were mentioning on the oil industry. You could have dentists using this technology from South America, Central America, Europe, North America, and then we just started, how are you managing this space, or how are you milling this? Are you going into what speed for this material, and so on? And that really has been productive. Nowadays, we create content, very practical on videos. So the late adapters that are now getting into this have it very clearly explained.
And it's funny, you say the late adapters. I have, again, after the oil and gas business, and viewers probably know this by now, but getting into the dental implant world for the last 5 years now. Golly. I can't believe it's been that long, but I have seen, even in that 5 years, what technology has done. Yeah, and again, I'm coming at this through the patient's eyes. And I think you even saw one of my videos where, I talk about I hate the dentist, because our family had so much trauma. It really did. Sure. Because what I've learned about, there are some really good clinicians out there, and there's some really bad ones out there. And as patients, how do you know, right? I mean, we didn't even, back in the day, we didn't have Google reviews. We didn't have any of that kind of stuff. And so apparently our gut was off on trusting. And so, to see how technology has now come and really made it not only more advantageous for the clinician, but really advantageous for the patient too, and their final product, because now you're taking some of the variables out of the way, because now it's computer assisted. It's a program. It will show you, and yet you got to be trained on it, but it's not like just hit a button and it's done, but still now your quality of work increases. Would that be a fair assessment?
Yeah, totally. And like it said, you cannot treat what you cannot see, right? So with these technologies, we can see much more of the needs of the patients, whether it's with CBCT and making this correlation with the images from the intraoral scanners and the face scans or the photos, to really not only focus on the tooth isolated, but make sure that they're blended dentofacially as well. And also, this gives more possibility of having a better quality of final restoration. In the past, sometimes there were very few labs that could have that level of very high quality and precision. And with technology, I'm not saying it works automatically, as you're saying, by itself, but it gives a higher percentage of really good quality. Of course, you still need someone to understand it and operate it, but that's something very positive as well. And then as we have more industry partners competing as well, they come with good ideas, newer materials, then the cost of some of these technologies start to drop down a little bit, and that's where you see more clinicians being able to invest in them for the benefit of the patient. So it's kind of a cycle, right?
And where I was going, and I apologize, I kind of derailed, but the early adapters, there's a lot of clinics out there that still don't do CAD CAM, that don't do, I mean, a lot. And so when you talk about the late adapters, it's almost like it's, at least in my, I mean, I don't, please don't let me speak out of term, but from a patient's perspective, getting to see all the clinics we've seen, I would say maybe 25% are using now. Maybe it's probably up to 50 now that it has become more profitable. But I know some very large clinics that we went to consultations with that don't do any CAD CAM technology. And so what, from a patient perspective, how important is that? So if I went to Dr. Bob down the street, who my neighbor said, yeah, you fixed my teeth, all right, and I go in, how important is it for me to ask Dr. Bob, do you use CAD CAM technology? What help me out with that? So patient sides.
I understand. I think it's very important because the dental world or industry has moved towards that direction. So the best materials that we have nowadays, for example, the newer types of zirconium oxide can only be produced and manufactured through CAD/CAM technologies. So if you or your lab are not involved in this, you're not being able to use the best materials that are available there. Years ago, we had gold alloys, and great quality dental care was made as well, with very high cost, and now that's not maybe the norm, right? So the technology has changed, but new materials have come to substitute what was the gold standard. And
literally,
if you're not into this, then there's many benefits that you're losing.
Yeah.